Akwo, Ntuba, the chief editor of Health and Development magazine, and we are at the Convention Center, city of Houston, as part of the AACN Annual Conference 2022. With me is
Janae Gomez.
Nice to meet you, ma'am. Where are you from?
I am from Bedford, Texas. It's a little town in Dallas-Fort Worth area.
So what do you do in critical care area?
I am an ICU nurse at our community hospital, Texas Health HEB.
So what did it take for you to become a critical care nurse?
Oh goodness. Well, I've been a nurse for 9 years. I have my bachelor's of science in nursing, so 4-year degree. And I actually just started ICU about a year ago. Prior to that, I did 8 years of progressive care, and so I learned a lot there and wanted to improve my skills and grow and learn more, so I moved to the intensive care unit.
What does this American Association of Critical Care Nurses Conference do to you? How does it improve on your work, outcome, your life, your family?
So this is my first conference, and I've wanted to go for years, but this is the first time that I've been able to. And especially at this time, coming after 2 years of pandemic, it's been really encouraging and uplifting to be with nurses who I know have experienced the same things that I've experienced, as well as the main reason I came here was to increase my knowledge so that I could take that back and better care for my patients.
Increase your knowledge. So what is new that you learned from here that you didn't know before?
I've gone to some courses on specific disease processes like sepsis, reading EKGs, so learning how to pay better attention to the details of those. Those are just a couple of the things that I've learned so far.
You visited the exhibit floor, right?
Yes.
What is exciting? What is new? What is there that you would like to say that your colleagues who have not been to the meeting should come next year?
I looked at the career development area, so just interested in how I can further my career and other options within nursing.
You know, there is obstetrics and reproductive health and related things, that there is also critical and acute and emergency issues related to them. People, when they hear about critical care, they are told that, okay, these are health personnel who address, life-threatening issues in patients. Those life-threatening issues could actually be complications of chronic health problems. A diabetic patient could come up with a coma, and you have to deal with the Glasgow coma scale related things. People have died from hypovolemic shock. Some have died from, hypoglycemic coma, hyperglycemic coma, the osmolality issues and everything. So critical care is general medicine, which is life-threatening.
Yes.
So I want you to talk to me about the abortion and reproductive right issue. There are people who don't know that there are women who die from committing abortion and things like that.
Yeah.
And then there are also those who don't know that just keeping a certain fetus can also complicate a woman's life and lead to life-threatening situations. So can you speak to whoever is listening to you in the community out there on this issue?
I think the issue is multifaceted, so complex. I don't feel like I can give a simple answer, but from a healthcare provider standpoint, thinking of the safety, as you mentioned, I just think that people need to have access to safe care. I think that's the simplest answer. I could say so much more, but from a healthcare provider standpoint, people deserve access to safe care.
And you are a mother, right?
I'm not, no.
All right, I wasn't putting you on the spot. It's okay. So Finally, there are minorities who may need to come to critical care. What do you have to say to them?
The difference.